Hi, my name is Caleb Ng. I'm an assistant professor of clinical anesthesiology at Columbia University Medical Center, and I'm a pediatric anesthesiologist.
My name is Dr. Dean Andropoulos. I'm the Chief of Pediatric Anesthesiology at Texas Children's Hospital in Houston, Texas, and also Professor of Anesthesiology and Pediatrics at the Baylor College of Medicine.
My name is Peter Davis. I am anesthesiologist in chief at the Children's Hospital of Pittsburgh of UPMC. I think the practice of pediatric anesthesia has been like a pendulum. 50 to 60 years ago, there was the concept that anesthetics might not be good for children because, in fact, they might be too sensitive. There was a higher incidence of cardiac arrest in children. Some of the anesthetic equipment wasn't modified well enough for pediatric use.
Anesthesia in general for children is much safer over the past 25 years because of advances in the training of anesthesiologists, in new drugs that are shorter acting, and better monitors.
And now today, as we have learned that anesthetics actually ameliorate some of the stress response to surgery, we now discover that there may be a downside to this.
It turns out that most of the common anesthetic and sedative agents we use do cause problems in the neonatal brain or the developing brain.
Initially, it was thought that only children who are exposed to multiple exposures were at risk, but new evidence seems to suggest that even children with a single exposure may have an increased risk of disability compared to children who have never needed anesthesia and surgery at all.
As the practice of anesthesia has evolved, there clearly is an impact on children.
While an association has been found between exposure to anesthesia and long-term cognitive effects, we don't know if this is due to the anesthesia itself, surgery, or some other factor such as the child's medical condition.
At the moment, this is an issue that's not very clear. There still remain a lot of questions. Are there differences in the anesthetic agents with regards to neurotoxicity? If neurotoxicity does exist, is there a toxic threshold for the anesthetic agent? Is it dose-related or is it time-related in terms of length of exposure? I believe that these are all the present-day questions that are sort of driving the specialty and that people want to know.
Yeah, the specific agents that have been implicated by the research as being problematic are most all of the common anesthetic and sedative agents that we use.
There are isolated studies that will suggest one might be better than another, but other studies haven't necessarily supported that evidence. We don't even know what the vulnerable period is for a child, if this is a problem and it does exist. Is 1 year enough? Is 2 years enough? Is 5 years too many? We don't know, and I think these are some of the other questions that need to be addressed in all of this as well.
There's still a lot of complicated clinical questions that need to be addressed, such as the contribution of surgical stimulation, whether a combination of anesthetic agents is worse than one particular agent, and whether different anesthetic agents have different effects.
There are many what we call confounding factors, many other variables that can influence neurodevelopmental outcome, such as surgery, pain, stress, inflammation, pre-existing medical conditions. Other things like socioeconomic status are all very difficult to determine from the retrospective studies. So the best study designs would be the prospective or going forward where we can collect all the data that we need to collect up front. And for example, it would be very important to test different anesthetic strategies.
Are there biomarkers that can identify children who might be at risk? Are there biomarkers after exposure that suggest this person may develop some sort of neurotoxicity from this? Is there a phenotype that we can identify that would say this is a person who now been exposed, is now demonstrating some sort of behavior or some sort of physical characteristics that we have to worry about? I think research in this area is incredibly important, because if children are society's future, then we need to be protecting the future of society, and we need to protect children.
We'll need more funding in order to try to answer some of these questions and ensure the safety of anesthetics in children in the future. As a SmartTots funded researcher, the funding has been critical in helping to move my project forward.
It will take multiple millions of dollars over many years. We estimate something like a minimum of 15 to 20 years, and it may require as much as $30 to $40 million to fund enough high-quality studies to really have a definitive answer to this problem.
These are all the reasons why I think organizations like SmartTots needs to exist, to help fund some of these questions, to help with some of these answers. It's clear that this is a problem that affects our smallest patients, our most vulnerable patients that don't have outside organizations or lobbying groups that are working for them. And so this research needs to come from within and needs to be supported. But it's the question that I as a parent would be haunted by, and it's a question that I'm sure the parents who come to us with their children and who trust us to take care of their children want answers to. This only comes through financial support, through organizations committed to the welfare of children.